Every day my focus is on how can I promote my team to be the best they can be.
This strategy, the 6 C's, it's the reason why I get up every morning. It's the reason why I became a nurse.
It's a very exciting time for nursing.
It's being caring and going that extra mile for someone.
It's now a part of our culture.
For me, it means putting yourself in somebody's shoes for at least one day.
It demonstrates the passion, the commitment.
It means being involved in people's care. It means communicating and having those conversations at the right time with the right people.
So the 6 C's encapsulates the reason I'm striving to improve patient care and to share that culture with my team.
For me, as a parent carer, the difference that Compassion in Practice makes is just the tiny little tweaks to existing ways of doing things.
It's all about understanding the patient's needs.
6 C's have made me feel more valued at work, mainly because it gives a new structure.
I think it's a very powerful quality framework and they clarify what we do.
That's wonderful.
You need to communicate with the staff, with the patients, with relatives. You need to be compassionate. You need to have courage if we're doing something wrong. Don't be afraid to speak up. You need to be competent of what you're doing.
As a student midwife, the care and compassion side I feel is just built into you.
The 6 C's are embedded in everyday practice. So for me as a leader, it's important to be a role model and ensure that other nurses are communicating with the patients and their relatives.
The 6 C's are very relevant to mental health. It's trying to encourage people to relate that to their practice. And it's a joy to hear them saying, well, I'm doing that, aren't I?
Duty of candour is huge now. Talk to our patients, they're our best witnesses. Our training is there and we can demonstrate and evidence that we're competent in the care that we give.
There is no half measure on this. The resident's experience in a care home is very important.
Very well. All right? And I see you again later.
I think Isaac's been lucky enough to have a team of professionals around him that are very committed to delivering compassionate care that's underpinned by 6 C's.
The 6 C's are the future of the NHS because they embrace all of the key competencies.
How are you feeling today?
Not too bad.
Thinking of the future as a nurse leader, offering a world-class service to patients, there's so much more we will be doing.
Hospital admission avoidance is extremely important.
Medication management is crucial. Using modern technology face-to-face or via applications like telehealth will save time and prevent delayed treatment.
We have a key role to play in promoting a different mindset.
The work, sometimes it can be really stressful, but when you're finishing shift and the patients are happy, they are well looked after, you've done everything that you could.
It's not an easy job, but I go home and I feel very, very happy with what I've done in a day, and I can feel proud of myself.
I don't believe age is a barrier to nursing. I think I've been very privileged to be a district nurse, going into people's homes, sharing some of their most personal issues with them.
Primary care is the future of the NHS, delivering care that people need much closer to home.
If I had a fantastic day, I almost just skip out of the hospital. I want to tell my housemates how privileged I am.
I did a shift the other evening and it was a night shift. That was nice because I get to tuck everyone in and put them to bed and sit with them while they have a cup of chocolate or whatever. And even though it's one of the things that you can't measure in nursing, that shows compassion in practice.
Working with a team that is all committed to making a difference for babies and their families, those are the best parts.
Compassion in practice is definitely leading us into the next decade as dynamic nurse leaders.
We have some amazing people in this profession and they do amazing things every single day, and that is something to celebrate.